It is 8:04 p.m. We're a little bit late due to technical difficulties, I think, on my
Mm,
end. Hello, Mom. How are you?
I'm good.
So, anybody who's my age, Shauna's age, a little bit older, a little bit younger, maybe even much younger, I don't really follow the times as far as music these days. We are familiar with the term Munchausen syndrome because Eminem, Marshall Mathers, would mention it quite a bit in his lyrics when he was referring to his mother. So, if you could give us a rundown, a non PhD definition about what Munchausen syndrome is, if you could, please, what is it?
Fictitious disorder. It's the pursuit of medical tests, surgeries, medical procedures when there's no real physical basis for it. So it's when the patient, different than hypochondriasis because it's marked by many more procedures, they'll go to extremes. It's a very, very rare disorder, by the way.
Is it
So
rare?
it's pretty rare.
Because I
I've
feel
only
like I've
seen
heard
a
about
few
it quite a
cases.
bit over the years, but I could be wrong, obviously.
You hear about it because there are some quote unquote bizarre syndromes. For example, there's a conversion reaction where the patient can be paralyzed and there's no physical reason. I've only seen a few cases, but you'll see a lot of talk about these kind of rare syndromes. But yes, I've only seen a few Munchausen's patients. But it's the mark, a lot of people have some hypochondriasis. They always think they're sick, this and that. But they wouldn't expose themselves to all these medical procedures, tests, scanning, imaging, um, radiation. There's no limit to what they'll expose themselves to. But I've found some ways, and we'll get into it, to determine if somebody is having that fictitious disorder or if they're really sick. Here's the problem: you have somebody in your family who has a disorder that's kind of hard to diagnose, right? So it's
Mm-hmm.
a fine line. You understand what I'm saying? It's a fine line, especially if it's a female. The average woman with MS or lupus takes 7 years to get a proper diagnosis. And so sometimes people don't say they have Munchausen's, but they might say, I don't think so much is wrong. So it's a fine line for the therapist between if they're imagining, making it up, or if it's just something that's difficult to diagnose. Does that make
All right.
sense?
Yeah, but we're getting kind of boring. So let's dive into the good stuff, if you will. Not really the
Okay.
good stuff because that will get us canceled. So whenever I think Munchausen syndrome and in particular the article that I sent you today in regard to it says woman arrested for child abuse due to suspected Munchausen's by proxy police say. And then like I said, Eminem's mother, it's she's not Kim, but Eminem's mother apparently had Munchausen syndrome too. So in the few cases that I have seen Munchausen syndrome be brought up and it makes the headlines and things of that nature, and a friend of mine who's a teacher who has also leaked a story where the mother may have had Munchausen syndrome. I can't remember if that was confirmed or unconfirmed. Right there, there's a pattern. It's the moms. What is it? Is there men? Is it happen with men? Why is
I've
it the
had a male.
moms? And why do they want the kids to be the experiment?
Okay. Now you switched topics. You went from Munchausen's, where it's in the person, to Munchausen's by proxy, where it's the child's or a loved one. But that's fine. So
So that's what
Munchausen's
the
by
by proxy
proxy.
is. You have Munchausen's, but you're projecting it in someone else.
Right.
Okay.
So one is that you just do it for yourself, Munchausen's disorder, fictitious disorder, and one is that yeah, you're more preoccupied with somebody else. I did have a few fathers who had it, but it of course it's more common in moms because who has the closer relationship with the kids in the early years? Often it's the mom. And we talked the last podcast was about abuse and violence. It is a form, what definitely a form of child neglect and abuse. So when it's by proxy and it's in a child, it's a form of abuse.
It doesn't seem like it's
And
neglect because they're putting a lot of effort into. making up these symptoms, a list of symptoms.
On the surface, it
That's
doesn't
a lot of
seem like
effort.
right. However, it's what they'll do. So, and that's a good point. Here's the interesting part. How does the symptom arise? Sometimes they put poison in the kid to make them symptomatic. Sometimes they expose the kid to extreme weather conditions. It's what they do to create the symptom. The symptom is not real, it's not coming from a disease, disorder, structural problem. So that's where the abuse comes in as to what kinds of extremes they'll go to make the child symptomatic. So don't be fooled by that they want to get them medical care. They've created a lot of the problems. They also tell the kids to lie. So that's another form of emotional abuse, correct? You're telling the kid to lie to the school nurse, to the physician, to exaggerate, to make things up. It's an attention seeking, exaggerated form of abuse, either abuse of your own body or abuse of a loved one. And you cannot talk them out of it, right? It's good that I saw in that article it's become a criminal matter because you can't talk them out of it. And like I said, I don't mean to be boring, it's not such an easy mission to tell a parent not to take a test because some things are not so easy to diagnose, right?
So,
So it's not that easy. But I just want to say this, but when the smart doctors put together the cause of where the symptom came from, that's sometimes the first break in the case,
so
right?
a lot of we've been talking about this a lot. We talk about it often. Is where I blame the system, you blame the system. In this particular case, I'm going to ask you. My one friend said that when the mother that they were referring to had Munchausen syndrome by proxy, the kid actually ended up with a feeding tube. So how does that get by people like you? How does it get by the? Can you fix your hair? It's in your glasses.
Oh, yeah, sure.
There you go. Sorry, it was kind of bugging me like a dog's
That's
flip here.
okay.
How does it get by you? How does it get by doctors? How do you get to the point where you're allowed to put a feeding tube in a kid? I mean, we are to trust that you, the doctors, are making the right decisions, that you're making the right diagnosis. But this kid was allowed to have a feeding tube. Once the mother left the picture, that's all I'm going to say. Suddenly, the kid was fine. No feeding tube needed. No diagnoses. No anything like that.
Oh, but the parent can have a hypnotic effect on the kid. I'm not familiar with all the facts of that case, but they can tell the child that it's very important that you don't swallow. It's very important that you make this kind of syndrome. They can do some things to irritate the child's throat so they can't swallow. That's my whole point. That
Hmm.
these symptoms, see what I'm saying? That
Mm-hmm.
until the physicians, nurses, psychologists realizes that they might have created the very symptom that they're complaining about. It wouldn't take that much to scare a young child to not eat or swallow. You could probably do it to one of your kids and scare them so that they wouldn't eat or swallow if you wanted to, if you put your mind to it,
It's a scary thought.
depending on how young, right, depending on how young the child is. But look, it doesn't start that way. It starts with a picture of all kinds of symptoms. And here's some of the things you learn about it. Of the few cases, because I said it's rare, that I've seen, nothing ever adds up. So that's the first clue. None of the symptoms ever add up or lead anywhere. You see what I'm saying? So then you start to get suspicious. Like the kid had a little bit of this, a little bit of that, but nothing adds up. And the parents, the mother, usually, like you said, it's usually the mother, is insistent on more medical testing. Now that's a red flag, isn't it? You would never be happy that your kids needed to have a lot of procedures or tests, right? So
Yeah.
you learn over the ropes of treating this. You see that they're not happy when you say, "Hey," in one of the cases, we told the parents, "Just take a time out, right? Let's just take a time out." It was an older child, 14. Let's not do anything. They didn't listen. They just went to another facility. Here's another thing when you say, how do they get away with it? I don't know that there's a great massive hospital system. I don't know if anybody knows. So if you went to Penn, then can you go to the Mayo Clinic in another state? You see what I'm saying? That's what they do. They travel around. They mix it up. They don't stay
Let
with the same treatment providers.
let me ask you a question. Random
Sure.
question. All the moms are about to get mad at me. And before
Hmm.
all the moms get mad at me, I love my wife. I know that she runs this house and keeps the family going. So everybody just fucking relax. Um, it's always the mothers when it comes to, I'm from what I can see, right? Not to say that there's never any cases with dads, but I feel like the moms make the headlines a lot more for things of this matter, like we've said on prior podcasts, reaching the breaking point and harming the children. What's all that about?
I think, well, that's a good question. I have seen two men who had a form of the Munchausen's by proxy because of the testing, repeated surgeries and testing that they let the kids get exposed to. But I think what it's about, and I was thinking it after our last podcast, is about the pressure, expectations that we put on women and the breakdown of the support system. So some of the crazier things that we see, abusive things, I don't think we saw quite as much when there was a better support system. So grandmom or aunts or uncles lived down the street, around the corner, more of a neighborhood, more of, hey,
So
there's somebody I could call.
what you're saying is Italians don't. It doesn't happen in Italian families.
I
Sorry,
wouldn't say it
that's my bad joke for the evening. I I just listen, and I always give Monica. She'll tell you until she's blue in the face, or at least I hope she would. Is that I probably praise her on a daily basis just because I see what she puts into the day. I see that what she puts into taking care of the kids. And before anybody's like, well, why aren't you helping her more? First of all, I do my part. I do all the laundry. I'm just going to say that. I do the laundry. But besides that, I am very involved with my kids. At least I believe I am. And I would hope that Monica, my friends and family would agree. But Monica actually told her therapist, and this is not a secret because we did a podcast. My wife and I both see therapists and seek counseling on our own to keep our minds healthy and keep things going. She told her therapist that one of the things that drives her nuts is when I help in the morning because I throw off her routine. So it's not a matter of me not helping. It's mom feels better that she did it and it's a checkbox in her head that is checked and she is she is in her zone. She's found her rhythm for the day. She has a plan in her head and she's executed it. If I jump in, I've thrown the whole thing off. And I'm not saying that she doesn't mean don't help with the kids. If I get them up and get them dressed after I work out or after we work out, well, then I've thrown off her day because now she hears the boys and it's driving her nuts. She feel like she needs to tend to them right away instead of being able to take her time getting ready. She likes making the meals because she knows that she made two square meals for the boys and then one when she gets home. But the point I'm trying to make is that I am aware that there is a different level of natural, right? Just a connection that you can't explain between mothers and their children.
Sometimes I never make a all the time statement. So this is what I love about my son. He is so fascinated by the human psyche. So he asks a whole bunch of questions like he always does. So the first question, I'll come back to the thing with the women in a minute. The first question that's fascinating you is how does the mind get so screwed up? Whether it's Munchausen's, whether it's the
It
kid
drives
who
me
shot
nuts.
up the school. I know.
It literally
So
drives me nuts because I want to know what chess piece or what piece of the puzzle fell loose. Because I always feel like, sorry, not to cut you off, but I always feel like it might be one big thing or it might be one little thing that nobody had any control over that somebody saw or it triggered something in their brain or it was something that they were thinking about. And then one little event was like, that's it, I'm doing it. So that always blows my mind and scares me too.
It does. And the Munchausen's by proxy that we started out talking about is a form of abuse. They're not good parents. It is
They're
a
not good,
love
or they were
hate,
never good, or they started
never
to not
good.
be good. Never good. Okay.
Well, the ones I saw, never good. And love hate relationship with the child. And so Ryan's saying, but how could that be? How does the mind get that distorted? And we don't have all the answers. There are a lot of studies, I don't have them all in my head, some studies that say the brain, right from birth, the brain wasn't right. Not one event, something in the structure of the brain. If you look at sociopaths, there'll be studies that say that brain never formulated right. But the other thing you want to know is how does the brain get twisted in women? Do we see this all the time where they're complaining, but then when the husband helps, or their I shouldn't just say husband, their partner helps, they're not happy about it. So you're
Yeah.
asking, well, how does the brain get into that hypocrisy? But I don't know if this happened with you and your wife, my daughter-in-law, but for a lot of the women, it's because the husband didn't offer the help in the beginning. So think back where you were in
Well,
the beginning, and then now they worked out their routine, and now they don't want to relinquish that routine. We see that over and over in therapy.
Monica and I got into a fierce argument when I was working the overnight shift, like at the very beginning, because I was coming home. I had never worked the overnight. It was just part of the job I was working at the time, and I came home and I would go upstairs and I would go to sleep and I would sleep until 4 p.m. So in the grand scheme of things, Monica was never catching a break because even though I was home in the afternoons during the week, in the evenings, she's still go from waking up, going to her career, her job to take care of a bunch of kids, coming home, taking care of her own kids. And then on the weekends, where for most families, it's a joint effort. It was winter, it was cold out. She couldn't take the kids outside to break things up. And then I'm upstairs sleeping. So it was like a never ending cycle for her. And I said, well, just tell me what you want me to do so that I can help make the situation better. And she said, I don't want to have to tell you what you need to do. And
Mhm.
now I try to make the effort to see what can be done. If we're all at home and the kids are eating and the boys got covered in pasta sauce, Monica likes to give them the baths. That's a way she connects with them. She spends time with them. It's just something she likes to do. What can I do? I can clean up the dining room, right? So
Right.
that's finding the balance. But like I said, and like John said, and like you've said, it's very hard if you don't have a supportive partner or a partner at all.
And that's that old Mel Gibson movie about what the women really want. And
What
so they
women want,
say,
I
well,
love
if
that movie.
I love that movie. If I have to tell you what you have to do, then it's not that. Then you just made more stress for me, right? Because now
Yeah.
I got to tell you what to do. Now you stress me more. But listen, let's connect that back to this topic, which is a lot of times. Remember that Susan Smith, was that her name? She drowned 5 kids in the bathtub, and
Yeah,
she was
years ago.
homeschooling, right? But the husband, like, where was he? So the men do have to stay very connected in these Munchhausens by proxy cases to stay connected. Some of the reason the women get away with it is the men aren't really seeing what's going on. You understand what I'm saying? They're not connected enough to see what's really going on with the kids. The other thing you said is how does it happen? Now you're getting into legal, ethical, moral issues. What's the hospital doctor's ability to say no if the parent insists on something? These parents are convincing in the beginning, and they're smart enough. As the medical people get on to them, what do? I told you, they drop out of that hospital and go to another one,
Yeah, that's what my friend was telling me about Munchausen
right?
from what she's seen.
Right? They go from psychologist, from hospital to hospital. So the bottom line is we have to get better at diagnosing, at learning quicker when if the child's at risk, and intervening and like I always say, coordinating the care from the school to the home, the husbands, other family members. Where the heck were the other family members? Did they happen to say in that case you sent me? Like, where's everybody else?
I have a random question, and this is another question that's going to get me canceled, but I don't really care. Um,
but I, but I do.
no, you'll keep going, and you know what? Sometimes you get more famous when you speak what's on your mind. So you always say that the pandemic has created an issue with mental health, right? And
Correct.
you also say that a parent, man or woman, whatever, will be more successful with the support system. But right now, what's the mindset been for the last 2 years? Social distance, keep everyone safe, right? And that, even me as somebody who is vaccinated and is kind of just still doing what they want to do when they want to do it, so long as everybody feels comfortable. I I I I don't subscribe to the social distancing and all that stuff. But I still know that I need to be mindful of people's space and their comfort level and things like that. So with that being said, the blanket worldwide statement right now is everybody stay the fuck away from one another. But in the grand scheme of things, there are a number of people who cannot do it on their own.
They can't. And it's raised problems, like I always say, out of trauma is the immediate event, the trauma of getting the virus, being on a ventilator, being sick. But then there's the secondary trauma. So, for example, grandparents and older people that are retired help watch young kids. Agreed? I mean, that's just
Mhm.
common common sense. So what's happening is, who didn't get vaccinated, the younger kids, they're just starting to in bigger numbers now. So now I have younger kids who feel that they gave the COVID virus to their grandparent, and that's doing a horrible job on their psyche. Not saying that the grandparent died, God forbid, but even that they got sick. So, see what I'm saying? There's an unexpected consequence because they needed that support group. The parents didn't have a job. Not everybody has a job to do remotely. If you're in medicine, you can't do the job remotely. If you're in
And
transportation, you can't.
not everybody has employers who care. Like if I told
Right.
my directors tomorrow or tonight even, hey, I can't come in tomorrow, Jade school and virtual, they would say, okay, no problem, we'll handle it. Let us know what you need. Which to me, and I always say this, if you work, listen to me, if you work for somebody and you know they're not going to support you, you feel uncomfortable calling out, you feel pressure when it comes to your kids or family, putting them first, the health benefits are not worth your mental health. You need to find a new job, period. I don't care
Right.
about the salary either.
You
You'll
know,
hate your life if you don't already.
oh yeah. You know what? I'm gonna see if I can get any research as to Munchausen's by proxy and the pandemic. It'd be interesting to see. Remember, I said those parents are abusive. They can't get the test. You can't even get tests now done if you're really sick. And I wonder if they convert to other forms of abuse because they're stopped. You see what I'm saying? From getting the medical appointments. I'm going to see if I can find anything out. I
When
think
the
that would be interesting.
when we were at the height of the pandemic and remote learning and all that crap, one of the um one of the things that really upset me is that like once a week or every other week, Alexis would see on social media that a kid was missing. Now the kid wasn't like missing for days at a time. But unfortunately, there were numerous cases where the kid had just left the house, went to walk around the park or whatever, and that really upset me because, we and I'm glad that a lot of people, governors, mayors, everybody are holding their ground with keeping the kids in school now because I know that people are like, "Oh, well, we're keeping each other safe and this, that, and the other thing." Okay, fine. But a lot of people don't understand that school is the safe place for a lot of people, especially teenagers, especially kids who can't, like speak for themselves or anybody's not listening to them yet. That I don't know how long school is. I didn't stay in school that long. 6 hours, 5 days a week helps break things up for the family that is not quite getting things right.
Right. But school, get back to our topic, the parents with the Munchausers tell the kids not to trust the school or not to tell the school nurse certain things.
And how many kids
That's
have you
what
met
we
that
have
were
to get
smarter than
better.
their parents? Like they were
Depends on
on
the,
to them. Like they knew, like, you're not telling me the right
you
thing.
know, okay. So your kids were not sheltered. Your kids had lots of experiences. So you come from that kind of mindset. But some kids are not as fortunate as yours. And if the child is very sheltered and all the control has been through the parents, then it's not that they're not so smart. It's just that they don't have experience in trusting anybody else. You see what I'm saying? Because These kids, anytime there's abuse, what's the first rule of an abuser? To isolate, to tell the
Right.
person not to trust anybody else. So I think for all of the things that you bring up, anxiety getting worse, whether it's Munchausen's, any psychiatric disorder, we just have to get better at protecting kids, picking up the disorder quicker, having the schools get more involved. Sometimes the schools take a hands-off approach. They don't want to get us involved. They say that's not their role. Is
I'm
that
not
their
trying.
role? The role is to educate the child. Is it their role to get involved in medical things that the parents are doing? There's a question. I don't know.
I think, and I know a lot of people are going to disagree with me. I think that, well, actually, maybe they won't. If you take a step back to um, spring 2021, first of all, there's some people, and I hate to say it, I really hate to say it. I believe that there's some people who enjoy COVID in the sense that they enjoy the social distancing, they treat it like a regiment. Does that make sense? They have their masks, they play by certain rules, right? I'm not dismissing the severity, if I'm not dismissing people's comfort levels, but what I need to point out is that when the masks were coming off and CDC said if you're vaccinated, you need to wear your mask. I walked my kids to school the next day. I did not wear my mask, right? We all follow the CDC. We all follow Dr. Fauci and everybody else. It's fine. When they said you didn't need the mask, suddenly were talking about how the CDC and Dr. Fauci were wrong. And in my head, I'm just like, what the hell do you people want? Okay. So now granted,
Hmm.
the Omicron came, Delta came, things kind of reverted. But remember for that a few weeks, a few months there, as soon as the masks could come off, as soon as you could go into a grocery store with your mask off, people liked each other again. Businesses were
Yeah.
making money. Restaurants, you couldn't get a table. The airlines couldn't keep up with the demand. Hotels, we were getting fucking crushed by the people who were like, screw this. I'm going on vacation because we can go on vacation again, right? I'm curious to see how humans begin to interact one another if there's more of a sense of community, if people feel like they need to stick together and be together. I'm curious to see how that plays out as far as mental health and relationships when the day comes where every headline isn't counts, hospital counts, Omicron, Biden says this, Fauci says this, CDC says this, who says this. I'm curious to see if there's a like overwhelming wave of happiness and unity again, if that makes sense.
Right. But I always say that trauma, so this has been traumatic times, trauma doesn't change your basic character. So back to you said, how's it affect everybody? Some conversations with people I work with, I start with, has COVID impacted you this week? Because we hear so many
This
people
week,
have it, family members.
this
Yeah.
week, you don't just
I'll
say
say
this
this.
month. You have to ask this week.
No, 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 no. People that I see weekly, I say. If I work with a
You
person
say
weekly.
how
Because,
did COVID affect you this week?
well, no, we're past the point
I
where
would
I
be like,
ask
shut
them,
the
is
hell
it
up,
because,
Dr. Joan. It was 7 days yesterday, now it's 5 days today.
no, no, no.
I'd be
In
like,
the
stop
beginning,
asking me. I can't keep up with it.
well, because there can be new diagnoses, but in the family, this week was tough because so many new people were diagnosed. But at any rate, it'll go
You're
like
gonna have
this.
a tough week because people were diagnosed. It was 7 days last week. It's 5 days this
Yeah,
week. It
it's
just got
tough.
blocked at
Yeah,
the federal level. And that's
right.
going to be a worry, right? And I was thinking about that kind of off topic, but the people who were counting on the why can't I think of it? What was it? The federal judges, Supreme Court
The,
justice,
the, right.
who were counting on a win as far as the vaccine
Oh,
being
yeah.
federally mandated.
Right.
I would imagine that they are about to have they're living in a world of fear now.
Right. There is a lot of fear. People will say that. But for the people who were introverted and didn't leave the house that much anyway, not much changed. They won't have that many integration problems. I don't think it's going to be such a smooth transition, though, because a lot of things have happened during this time. If you had any kind of anxiety, psychiatric disorder, it's probably intensified. That's why I said it would be interesting to see what happened with the Munchausen people because they're stopped from medical procedures. You hear in the news, right, where they say elective procedures were stopped. Well, their procedures are elective procedures for the most part. So I think if you have any kind of disorder, it got intensified because you didn't have access to your outlets. That's been the problem. Have I seen more kids leaving the house in the middle of the night, escaping through the bedroom window? You bet. Why? Because they can't see their peers. Because what do mom and dad say? Not during COVID. You can't see your peers. So we see more and more of the leaving at 12, 1 o'clock in the morning because they're going to find a way to see their peers.
How
They're
about this
not
one?
going 2 years and not seeing their peers socially. Yeah.
How about this one? Because we got so far off topic, but I'll try to wing it back as we get towards the end. How
Okay.
about, and this is something I always think about, and parents, I don't care what you think about me. You can ask Dr. Mom here. I'm pretty sure I'm right on this one. I'm pretty sure she is. I'm pretty sure that a majority of mental health and children and family experts are right as well. Our children are going to remember mom and dad saying, fuck that school and their mask mandates and their vaccine mandates. I'm just not going to send my kid, right? And what kind of mindset are we creating for our children when that's how we behave? When we're having that type of discussion in front of them and not behind closed doors, right?
If the
I don't want them to
right,
hang out with that kid's parents. They don't wear masks. They're not vaccinated. They're not vaccinated. I don't want my kid hanging out with them. Yeah, but I really like hanging out with them. Come on, he doesn't have a lot of friends. They get along with. No, they're not vaccinated. They don't wear masks. I don't want them hanging out. Like that's one of the things I'm afraid of with Alexis's friends and family, Jade's even. I just don't want that type of divide. I don't want that type of mentality. The point I'm trying to make is that people don't realize that they are instilling values in their children when they say things like this, right? And when I say values, I don't just mean like positive. I mean like this is the mindset that these kids are going to have, like the divide, right? There's no unity when that's how you speak. You're creating divide. You're creating that you're creating the mindset that your child will um decide who they hang out with based on the decisions they make. And somebody's going to be like, well, what the hell are you saying? I don't want my kid hanging out with a drug dealer. I understand, but there's a fine line. There's having an open mind and perspective and allowing other people to have their opinions while you also maintain friendships and networking. And I don't want to see those lines get thicker and thicker, if that makes sense. I want everybody to continue to be united.
No, and I think again, you're questioning that human psyche, and I think what you're saying in part, how do the parents not realize if I'm teaching the child to disrespect the teacher in this situation, this scenario, how they're
Mm-hmm.
going to go back to school and get their behavior under control? But you've seen
But
that little nasty dynamic in court, in custody court, when they
but
teach the
that
parent to
and
right.
the aggression, the judgment that they're
Oh
seeing.
yeah,
Mom and
I
dad,
see a lot of
mom and
judges.
dad judge people, right? Whether they were vaccinated or unvaccinated. If mom and dad took a fierce and passionate stance, I don't want him or her hanging out with so and so. Their parents aren't vaccinated. They don't wear their masks. I see what they post on Facebook, right?
No, John
They're
Anthony,
posting their
right?
opinions. Can we have a
True,
discussion?
but
No, real quick, one more time. Let you speak. I'm sorry. Last Saturday, I had a discussion with three friends. We talked about COVID. Politics weren't looped into the discussion at all. We shook hands and went home. No arguing, no disagreeing. We listened to one another's points and thoughts on the matter.
yeah, I mean, but that's rare now, isn't it?
It's very rare and it annoys me. Open your mind.
I don't think that's happening anytime soon because what's John Anthony say over and over? What drives aggression? Fear. I spend a lot of time with medical people in my,
Care less.
in my work day. But here's the thing: I see the fear in them. They understand this better than I do, right? They have a stronger science background, and I see the fear. So, if anybody has any medical scientific knowledge, they have to know it's a hop, skip, and a jump that we really don't know exactly what's going on with this virus. And that fear of the unknown, unpredictable, where's it going to end? We don't see an end in sight. That fear is what's driving all the
I
things
see
you're
an end in
talking
sight.
about tonight. Where's that end?
Oh man, I can't say.
I'm
Well, I
not.
mean, I can say. Maybe I will say. My thought now is that, and I'm not judging. I'm vaccinated. I feel the need to say that because people will
What?
take what I say out of context. Like I said, I'm vaccinated. There's things I don't agree with. There's rules I follow because there's the rules. I understand that people have comfort levels right now. I get all that. I believe that the end was with the decision that was made by the Supreme Court today. Do I think that it's going to happen tomorrow? No. Do I think that it'll really start to shape how things turn out over the next few weeks? Yes, because I think that that would have been a huge win for the United for the Biden cabinet, and I think it
Sure.
would have been a huge win because other countries and people would have followed suit. Right? It would have been that's
Right.
it. There would have been that's it. This is the standard. This is how
Right.
society and humanity is moving forward. And now that's not going to be the case. So, like the last thing that you were banking on, it
Right.
didn't happen. And we will need to live with it. You will need to live with it. We will all need to move on in some way, shape, or form. But that has to happen. It's going to happen. And I think that this decision today is what's really going to start to bring an end to the pandemic.
I don't know.
Because
I mean, that
the first
remains
end
to
of the
be seen.
pandemic, right, was the vaccine, right? Okay, that happened. It didn't work out like we all thought. That's fine. It
No.
protected a lot of us in many ways. That's fine too. But this would have been like the sword through the heart, right? And it didn't
Right.
happen.
Right.
It didn't happen.
No. And there'll be fallout, right?
Yeah,
There's going to be
100%.
fallout. But back to the fear is driving it. I think it'll take a while till the fear simmers down. And on the
Yeah, like
day
I said, it's not happening tomorrow. Yeah.
that the twin towers came down, I was with one of my smartest people I know, and he said to me as the news came in, "You see that? Life will never be the same." And guess what? He was right. In many ways, life was never the same. And I feel the same way with the pandemic. I think it changed our life. I don't think it in your lifetime. I don't know, maybe in Jade's and the boys, but even in your lifetime, I'm not sure it's ever going to be exactly the same.
I think it
Because what
is.
I'm trying to, I hope you're right, but what I'm trying to say is even if the pandemic does stop, now it entered the world of possibility of what can happen. And so for anxious people, for nervous people, they're going to rethink things,
But watch when that.
right?
But watch because I always say that the history lesson, like if something like this, heaven forbid, ever happened again, right? There would be groups formed by the public. There would be groups at the political level that would say, "Listen, we tried X, Y, and Z back in 2020 to 2022, and none of it was fail proof. So for us to think that
Mm-hmm.
these are the routes we need to go again, we would be outside of our mind because people are just going to start rebelling."
No, I totally agree with you. And I said we would be in a better spot if some of these promises weren't made. I don't want to pick on Dr. Fauci. Everybody should be like him at 80 years old. But obviously, he's done a lot right. But do you remember in the beginning, the what do you call it? The narrative was one shot and you're done. Everything's good, right? So that
Well,
created a false hope. But none of that was true, like you just said. So I've said from the beginning, I wish everybody had said, we don't know. It might be your, no pun intended, it might be your best shot to get the shot, to keep yourself alive. But there were a lot of false promises, right? And then when they fell apart, then there was more chaos, confusion, anxiety. Oh my goodness, nothing's working. Put the mask on, take the mask off.
I
So
think
what
it
I
would
tell
go.
people, yeah,
Go ahead. No, you go. Keep going.
I was just going to say, what I tell people is every day, just like any other day before the pandemic, every day you have to make some decisions. How do you want to use your time? Right? There's some things that you're not going to say no to. A wedding, a funeral, something from work. There's some things you're not going to say no to, pandemic or not. Some things might fall in another category. Just take it one day at a time. Don't worry about the end of it. Just live your best life each day and make a decision that you're comfortable with. And nobody should talk you into anything. That's the whole problem. If I want to get vaccinated, let me get vaccinated. If I
Uh,
don't, then I don't.
I don't.
Right? I don't think anybody should talk anybody into anything.
It blows my
Also,
mind that or maybe it shouldn't blow my mind. I know people would be like, "Oh, you're surprised," that the powers that be thought the best way to go about this would be imposing. And one of the things that Jocko said at his seminar when I was there, and it goes to leadership at any level, entry level management, the president of the United States. Jocko said people don't like having things imposed on them. And he said, like taxes on tea. And we all picked up what he was laying down. He was talking about the Boston Tea Party.
of
I
course.
think if for 2 or 3 weeks or a month they would have been like friendly reminder the vaccine's available, da, 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 you would have seen a lot more people just get vaccinated if you would kind of just let it be. I stand by that. I don't care what anybody says. People have a way of and John Anthony talks about it all the time. When you tell somebody to do something, they're going to be like, you don't tell me what to do. But when people see a crowd, no matter what it is, people are going to say, oh, let me see what's going on over there. Oh, that's what
Right.
people are doing. Okay, I'm going to give it a shot. No pun intended. But
Then go
imposing is the
back.
worst thing you can
Right.
do.
Right. And apply that back, circle back before we finish to what you said at the beginning of the show. How do the parents, the Munchhausers by proxy parents, get away with it? Because their mantra is the doctor's not going to impose something on them. I want this test for my kid. You're the doctor, but you're not the parent. So you need to do it. I don't want to impose your delivery of medicine on me, right? And my
Yeah.
child. I know better, kind of thing. So you're right. And that's what I said about a lot of the psychiatric disorders. The mind gets very rigid. You see, there's not a conversation. These are some of the things we see, just like with the people who are happy to be reclusive. All they see is that staying home is safe. But staying home might not be safe. There's home invasions. There's all kinds of things that happen at home. There's nothing that's 100%, Ryan. That's what I'm trying to say. And so I think you're right. When the government was trying to say anything was 100%, it wasn't good. And I think you're right. They, what's the word, triggered the rebelliousness of the citizens by saying you have to do it.
It
And
doesn't
yeah, it might have been a better outcome if they,
and friendly reminder to
it,
everybody who's listening, we're not picking on the government.
yeah,
You don't like it when your boss says you need to do what I say to do because I'm your boss. You don't, when your spouse, when your if, children rebel when you say you need to do it because I'm your parent. At any level, people rebel. What and Jocko always says you have to lay out the point people need to understand, but still, this was a very big thing that they were trying to impose.
and we have to have compassion that everybody was going at such a high speed because there's nothing to prepare you. So
Well,
you're
that's the
trying
other
to
thing.
figure,
You can't
right?
the people like myself, and I'm not trying to toot my own horn, who are vaccinated and say, and I mean this with every fiber of my being, I don't care if you're vaccinated or not. I'm vaccinated. I made that choice. My children are vaccinated. They made that choice. My daughter, she's 16, so she did make that choice. Um, but it can't just go one way. You can't be somebody who's vaccinated, wants everybody to be vaccinated, and not have compassion in the other direction. Does that make sense?
Yes, absolutely. Absolutely. So here's what I'll do.
Yeah,
I
wrap
will
it
try
up
to
because
find out.
I completely sidetracked the podcast. So go ahead.
That's okay. I'm going to get that, see if I can find anything out about what happened if it led to more abuse in different kinds of ways, more direct ways, when the Munchhausers by proxy parents were stopped from getting the medical tests and things. So I will say, I think that's an interesting question. I think that, like I said, always coordination of care. It shouldn't be so easy to go from one medical system to the next, especially with kids. And I will ponder your questions with you. How does the psyche get so out of whack? So out of whack. But listen, I've interviewed serial killers. I've interviewed the psyche at its worst. I can tell you there's not any one answer, but it's quite mind blowing to see it. It really is something else. And when you see, to the original topic tonight, the parents exposing kids to so much risk, the opposite of the parental instinct, every parent wants to hear, oh, yeah, your kid's fine. They don't need any tests. It really does keep even me, with all my experience, up at night. How does the mind get so warped? But we don't have all the answers just yet.
Hopefully we will.
Someday.
One day.
One day. Hopefully.
Well, we got completely sidetracked here, but that's the beautiful thing about podcasts is the conversation can just keep on going. So it started out, we were talking about Munchausen syndrome by proxy, and we got into a few other topics. And don't cancel us. We're just speaking our minds. Be understanding. We'll listen to you. You listen to us. You don't agree. That's fine. That's fine. But that's just where we're all at.
Trying to bring it back to conversations and not confrontations. And I think that's what my son was saying about the teachers and the parents, to be careful, because the kids are getting exposed to parents picking on the schools, picking on the teachers, picking on the government. Take that bigger picture. The best way out of anger and these kind of rigid thought patterns is the bigger picture thinking. How could anybody know exactly what they're doing? We all did the best we could, right? Because nobody knew. You were in a field, Ryan, that was hit so hard. So was your wife. So was I in healthcare. So how could any of us know exactly what was going to be? So we have to have some bigger picture thinking and not just criticize, for goodness sake. But in the end, we did bring the horrible part of the virus under much better control. We don't see as many people on the ventilators. We don't see the virus like it was the original virus. It's more down to a cold, right?
Yeah.
In the end, overall, the government did a decent job, I would say, right? If you look at the big
job. It was a joint effort.
If you look at the big picture. And I'll tell you what, if you're a big picture thinker, you won't have many mental health problems if you can always pull out and look at that bigger picture. So you're going to go home and figure out what Monica needs you to do and not ask her. That's my advice to men. Figure it out. Don't ask.
No, the kids are asleep. I'm going to bed.
Okay.
All right.
Give the kids a kiss. All right.
I will.
Everybody,
thank you, Mom. We'll see you next week.
Care.
Thanks, everybody.